In our Northwest Province, healthcare funders and practitioners from across the region and as far afield as the USA are wrapping up discussions around the changing landscape of healthcare in pursuit of universal access. The adoption of the National Health Insurance continues to be the highlight of discussions as stakeholders wait with bated breath for the announcement by Health Minister Dr. Motsoaledi regarding the amendments to the Medical Schemes Act. For more on this, we cross to our reporter, Sentleeng Lehihi. Good afternoon, welcome to the SABC.
Greetings to you and our view. It's the fourth and final day of the 19th conference of the BHF. We've seen quite a lot of talk about bringing the national health insurance to make sure that all stakeholders from private to public sector come together and collaborate to ensure that the greater community has access to universal health care. Next to me, I'm with Dr. Mutudi, just to give us a wrap of the events that we've seen in the past few days. Dr. Mutudi, highlights of the past 3 days rather.
We've had voices from the health citizens. We've had voices from the healthcare practitioners. We've had voices from the medical schemes who are members. And the discourse was really around what next. We've had a lot of talk about the theory, what can we implement. And the takeaway messages were really around leadership, that we need to strengthen ourselves in terms of training up leaders and making sure that they run ethical entities so as to prepare for universal health coverage. The healthcare practitioners talk about inclusivity. They want more awareness in terms of their role that needs to be outlined, and collaboration is key. There were further technical discussions around other inhibitors in terms of making sure that what we deliver to the health citizen is clean and is of good quality and local. So we've had discussions around fraud, waste and abuse. There's been an overwhelming support of the discussion around collaboration, not just from the schemes or administrators, but also from the NPA, the Hawks and other law enforcement areas. We've had input from the special investigations unit who want to participate and make sure that whatever we do is within the law. So overwhelming support and discussions which were largely positive. We do not want to take away the fact that we don't have challenges. We do have challenges, but at least there's intention to figure out what to do in the discussion to implementing universal health coverage.
Now, Doc, as we break away today, we break away with high anticipation. Dr. Motsoaledi is expected to give us what will really be entailed in the amendments of the Medical Scheme Act. What do you anticipate?
There's a lot of anxiety at the moment because you do not know what is contained in the bill. Although reports in the last few weeks or so have been speculating around the restructuring. But the intention of the conference was to say, what do we as an industry or what can we do even prior to legislative reform? So a lot of the discussions were around how to refine and refocus our service provision. We will support from a principal point of view because we realize that universal health coverage is for the betterment of service provision for the healthcare citizen.